Good evening and welcome to our Evening Rounds podcast. My name is Dr. Anthony Hilliard and I'm a cardiologist here at Loma Linda University Health's Faculty Medical Group. Now, you usually see me as the host for our Evening Rounds podcast, but tonight I'm going to be the guest, and I have the distinct privilege of having Dr. Martin interview me as the host for this podcast. If you like what you hear tonight, I would encourage you to take a look at our prior episodes on Spotify, Apple Podcasts, YouTube, or our Evening Rounds webpage. And remember, click the link to subscribe.
So excited to be here today, to have the tables turned, and honored to get to interview you.
Well, I'm anxious about being interviewed. It's more comfortable in the chair you're sitting in, but candidly, I would have nobody else interview me. I have so much respect for you as a on-campus leader, physician leader, and all that you do for our women and delivering their babies. So I'm grateful that you've taken the time today.
Oh, of course. Well, the feeling is mutual, and I'm looking forward to getting to know you a little better and putting this line of questioning kind of your direction. So I'm actually here today to ask you something that everybody is dying to know about you.
What's that?
What is one of the weirdest things about you that maybe some people wouldn't know if they didn't look hard and close?
The weirdest things about me. I prefer to think of it as very unique and
Oddities,
yeah.
Greatest Showman style.
Yeah, well, I don't know about Greatest Showman style. So my basketball career was impacted in a unique way that most basketball players don't have. I was a point guard, so you need to be able to use your left and right hand.
This is true. But actually you need to be able to do that as a post player in any position. So I'm already feeling the point guard attack right now as a post player.
Yeah.
The point guards think that they're,
well,
special.
Post players are just, size driven, but
it's so true.
But that point is, I'm a lover of the mountains. Our family's had a cabin in Colorado since the 40s. My grandfather, a long time ago. It's very rustic, and I spent a lot of the summers every year doing a lot of backcountry backpacking, things like that. And my basketball career was impacted quite profoundly after my first year of college. I was out trekking around in the mountains with some friends, and I fell down a boulder glacier field, and a boulder crushed my hand. So I lost my middle finger on that day, I guess you would say. It was day 2 of a day 3 trip.
Yikes. There are a lot of jokes there when you lead in with, I lost my middle finger.
There is. There's a lot of, I've used that a lot of great times in the future too. But I fell down and this boulder crushed my hand. I remember looking at my hand, and this middle finger was literally just dangling down here, and the 2 digital arteries were just firing off. Ironically, I had a Lucky Brand hat on, and I've saved that hat to this day.
Really?
But it was just speckled underneath the bill of this arteries just shooting up. And I remember
for some reason, that is like the grossest thing to me. I'm sorry for anyone who's listening and is getting grossed out by the excellent description.
I can tell you it wasn't a great day for me either.
Well, I'm a gynecologist and nothing grosses me out, but this finger description is quite...
Yeah, it wasn't painful. The second finger was split all the way down to the bone. And it was split. It was like filleted open. But I remember sitting on the side of the mountain thinking, oh my goodness, I'm gonna die on this mountain if, just from blood. I remember my dad coming down. He was up quite a ways.
Sure.
I always take the more difficult routes, and just for the excitement of doing it. And I remember taping it up and looking at it, walking down because it was by moonlight, and walking down, 18 miles out because it was day 2 of a day 3 trip. And, the finger, I had no sensation there. It was trippy because I could feel the 2 splints on either side of the finger, but I couldn't feel the finger. And I remember walking back to our cabin, and, my grandmother, who was still alive at the time, and my mother were like, why are you guys back at 3 a.m.? That's never a good sign, right? I said, well, my finger fell off. It was pretty crazy. My dad's friend had a fair number of Vicodin along because he was breaking in his boots. And so I remember taking like 3 of those and feeling like totally loopy, but it obviously helped the pain on the side of the mountain. And my dad was calling around for hand specialists on call. Ironically, there was one in Fort Collins at Poudre Valley Hospital, which my grandfather helped start back in the
Oh,
late
wow.
50s.
What are you,
In the
how
early
interesting.
50s. Yeah. And I was impacted by the surgeon. The surgeon, said, "Hey, are you interested in medicine?" I said, I don't know.
At that point, no.
At that
Yeah,
point,
right.
no. But he says, "Well, hey, just let you know, two of my partners who are hand specialists went into hand surgery because they lost their finger and
Okay.
the like." But, that certainly impacted my basketball career.
Yeah.
And to
'Cause
this
then-
day, everything is pretty much back to normal, except when I go through a drive-through. Patient, they look at me going, "Where am I supposed to put the change?"
Right.
So they think
That's
they're
so awkward.
Well, it is, I guess, because they're like, "What?" And so they put it way here at the, sort of the distal aspect of the hand.
And then it just probably
And I'm
rolls
like
right off.
trying to do. I'm like, if you just put it in the normal spot,
I'm only missing one finger.
yeah, it's not like I'm missing a whole, and the like. But yeah, that was certainly an interesting day. And I feel pretty fortunate. The rock, landed pretty close to my head because my
Yeah.
hand was back here. But yeah, I often will say I'm very angry at you right now, and you don't know what I'm doing with my left hand. So
Oh, gosh.
it's become sort of the joke amongst my friends.
Well, where you used both hands, but you shot left or
I'm
right?
right-handed. I just
But,
couldn't do my crossover or anything
Yeah,
like that.
well,
But
we all have to exit somehow.
yeah, and that and my organic chemistry grade both
Yeah, those two
influenced
things,
my
yeah.
career in basketball. But yeah, it's certainly at that age, at 21, I think I was at the time. It is rather, sort of impactful when these sorts of things happen. I had phantom pains. That whole
Oh,
thing is real. I'll suddenly
totally.
be like this and move my arm, and I found a little nerve right here that I could push and sort
Kinda
of stop
reset you.
it. Yeah.
Does it affect your threading of the wire
No,
on
I
that
actually
femoral?
tell the fellows, if they're really dedicated cardiology fellows, you amputate your middle finger
Well,
because you want to always pin the artery proximal and distal to your needle stick. And so now I can just do that without my middle
who
finger.
would have ever thought that
tell
this
ya, it
injury
was like- it
would
was like-
actually be
It helped my career.
Yeah.
It made me a better interventional cardiologist.
amazing? I'm interested in a little bit about the story of what brought you here to being a doctor. I understand that it wasn't exactly a straight line.
No, in fact, it's probably like Lombard Street in San Francisco. Well, I was born here, but growing up, I came from a family of physicians. My father's a physician and graduate here, and as is my grandfather. That was not the path I was going to take. I actually was very interested in finance and was choosing a path down that way. And then I got into tax accounting, and I couldn't think of anything more boring to do than to sit and study tax accounting. So I knew ultimately that wasn't for me. So then I had to think about what's next. It's not all about making money, and that's kind of where I was going for. And I realized that that's not what my heart desired. So I actually went in to the study of religious studies and philosophy, and ended up getting my degree there. But recognized that being a teacher, professor, really wasn't what I thought my calling was either. So I came back into medicine and enrolled here at Loma Linda, many years ago, and I guess the rest is history, so to speak.
Yeah. Now, what do you think it was that was driving you towards thinking you weren't going to be in medicine?
I think if your family does it, you want to try to create your own path. I have tremendous respect for my father and my grandfather, and they were actually very active parents in my life. So they weren't the distant physician, sort of never around, but
So lucky.
yeah,
So lucky to have that.
No, I mean, they were great role models for that career. It just, I wasn't a science guy. I'm still not a science guy.
I feel you on that. I actually think that's what makes you so special and different, right? You have this religious background. What do you feel like you draw from those alternative experiences?
Well, to me, the ability to practice medicine is to be able to help those in need. And I think that's really what drew me back to Loma Linda is, there's more to me about the practice of medicine than just delivering the care. It's actually trying to help the entire person. And I think that's really what Loma Linda's brand is about. And so that really resonated with me is, I want to understand why the patient's here. I remember a story that really stuck out to me when I first came back as an attending physician. And it was a woman who was admitted to our cardiology service again with a heart failure exacerbation, and she was deemed non-compliant. When you hear that non-compliant term, you start saying, wow, if this patient would just take her medications, we wouldn't be in this situation. So I went and chatted with her and I said, were you taking your medicines? No. And I said, well, you need to take your medicines. And she said, well, doctor, my daughter was recently killed in a automobile accident, and I had the decision to make whether I pay for my medications or pay for my daughter's funeral. And when I think about those stories, you recognize that the healthcare system is broken. To have that question be a question that somebody has to answer for themselves is really problematic to me. And so, when you think about those things, you recognize that the treatment of heart failure per se is actually very simple. It's these other outstanding questions, these social determinants of health that really impact our ability to practice. And so, I think having the opportunity to impact care in that way is what drew me back to medicine. It's not the science that drives me. I mean, that's a very important thing, but it's the ability to actually impact the life of an individual that you're caring for.
Well, I think you and I have similarities in the approach and the love of actually just people and communicating with them. And I think that's very special. I chuckled a little bit, though, when you said, like, the management of heart failure, it's pretty straightforward. Spoken like a true cardiologist. I will tell you that does not seem very straightforward, but some parallels would be that often we see women and men, again, with social determinants of health that maybe are barriers to them actually doing things. And it's hard as a physician to not get hardened to that a little bit and not do the little things, which is to just go ask them why.
Yeah, I say to our fellows and other people that, are rotating through with us that, if a patient dies and it doesn't impact you viscerally where, you don't want to eat the next meal, then that's the last day you should practice medicine. These struggles are real and they need to impact you in a very sort of profound way. Otherwise, I think the idea of becoming immune to these things, just doesn't resonate with me at all.
Yeah, absolutely. And I know that both of us also share that same kind of drive, and it's why I work here, and I'm so grateful to work here. And I think the sort of perspective of the patients that we all share, I always joke with you, for people who are listening here, that a cardiologist and an OBGYN should not have to talk to each other as much as I have to talk to you or your other cardiologist partners. And I think that I'm very passionate about preeclampsia and research in preeclampsia, which is high blood pressure in pregnancy. And our data from the OBGYN community shows that that is a window to the future cardiovascular health of a woman. And we know that heart health in women is so critical, and women have huge rates of mortality from undiagnosed cardiac disease or untreated, even more than men after menopause. And so what sort of insights or impact that would you say that you also kind of share in women's heart health? And I guess, I can talk about men, but it's not generally my area.
Yeah. So it's a really important subject. If most people are not aware of this data, that more women will die of cardiovascular disease this year than all cancers combined.
Absolutely.
And importantly so, we focus a lot on cancer awareness, breast cancer awareness.
Absolutely.
And I'm really thrilled for our community organizations that have really started emphasizing women's heart health.
Absolutely.
We have a women's heart clinic here. We recognize that men and women are different. So we have these different expertise in our own division here at Loma Linda. And so we have a women's heart clinic, and we have a genetics clinic to try to help answer some of these familial questions and things like that. So women's heart disease is a big deal. Their symptoms are different. And so trying to understand and learn more about that and to raise the community awareness for that disease, for this disease is super important. February is Women's Heart Month. I think it should be January, February, March, April, May, June, July, August, September,
Absolutely.
October, November, December. It should be 12 months a year. So I liken it to, there's a National Eat Healthy Day, and it is like my biggest pet peeve. We should have a National Unhealthy Eat Day.
Right, like
so
one
you
day
can
you eat,
have
yeah.
donuts and fried pickles one day a year, and the other 364, you should be healthy eating. Because in all honesty, the majority of cardiovascular disease can be prevented. I tell my patients, the greatest thing would be if I showed up to work and there was no patients and I had to look for a different career. We've won then. We've succeeded.
Yeah.
So much of cardiovascular disease is preventable. Even in a family history like I have, you can really delay the onset of cardiovascular disease if you take care of yourself.
I think the other thing that's interesting is the area that we practice in San Bernardino. I mean, we know that our patients have outrageous rates of high blood pressure and diabetes in a young pregnant woman age group. They go on to be your same patients just 5 to 10 years later. And so what is it that we're missing in our community? And I think, how do you see this way that we continue to partner as an entire faculty medical group to reach out to these patients?
Yeah. I think it's pretty simple. You are what you eat. I think our diets are full of sugars, corn syrup, things like this. I ask patients how much of your food that you consume actually would expire if you waited a month to eat it. And the answer is usually pretty low. We have a highly processed diet. Those are not foods that our body, was supposed to eat and use for nutrition. So there's not a magic to it. It's eating real food. It's exercising. It's meditating or having opportunities for you to reflect on the world. It's having relationships. It's taking care of your mental health. These are things that we can do that have demonstrable impact, and they start at a very early age. If we don't instill in our children and adolescents these characteristics, we lose. We know that. We have that data, that once you have these syndromes that you're describing, obesity and diabetes and so forth, the horse has left the barn.
Oh, yeah.
And, it's very hard to impact change at that moment in time. And so what we can do from an advocacy perspective in elementary age children is really, really crucial. How we impact kids who have a lot of social determinants of health that are not in their favor.
Yeah.
With our, institution, our community partnerships, things like this. How do we get into the churches?
Yeah.
How do we get into the school systems and take away the vending machines and provide them with fruits and vegetables is really, really important. And again, it seems somewhat, well, of course, that's what we hear all the time. Well, it's the truth.
Right. That's why we keep saying it. Yeah.
And we keep rehashing that time and time again. But that's really, really important. And that to me is a huge emphasis that we need to continue to prioritize. Otherwise, we're going to fail.
Yeah. Well, I want to switch gears a little bit because I have questions that are really important to me and hopefully anyone that would listen to this podcast. So one of my favorite things that I learned about you was, of course, more about basketball. People are going to be like, all right, enough about the basketball, you guys and the sports. But that you talked about how your experience on the team was very unique and diverse, that there was like a Jehovah's Witness. And it just reminded me of that joke, like a rabbi walks into a bar with a priest and a, So tell me a little bit about like this growing up on a basketball team with somebody of every religion.
Yeah. So this wasn't a basketball team. It was the neighborhood boys.
Oh, how fun. Okay.
It was unbelievable. So I live now a mile away from where I grew up. I haven't gone too far.
I didn't know that. Wow. Yeah. Okay.
Not far at all. But, we we were a bunch of 6 and 7 and 8-year-old boys having conversations about the age of the earth and things like this because we had a boy named Ben. He was a Mormon. We
Okay.
had across the street were two Jewish brothers.
That's
We
awesome.
had a Jehovah's Witness friend of ours that was 2 houses down. We had an atheist. We had a Polynesian family that believed in a different sort of religion as well. And then there was me, the Seventh-day Adventist. And so we had fascinating conversations. And we, I think they were sort of projections from our parents and their
Sure.
discussions. But you know what sat with me as I reflected on that is here are a group of boys that had very different backgrounds, right? And at the end of the day, we just loved hanging out with each other. It was riding our big wheels around, the local elementary school, and in that day and age, just be home by dark. So
Sure.
we were going all over the place, and so we developed these just really strong friendships. Whereas, if you would say, well, I am this religion, and then that was your defining
Sure.
moment, you might not ever cross paths with this great group of boys. And so for me, it was sort of a nice sort of illustration of how cultures can come together and be better together than they are, apart, and to identify with the commonalities rather
Sure.
than the things that separate themselves or make them unique. And so I look at that as saying, what a cool sort of analogy for how we should maybe, look at life in general. And we were totally, can you believe they said it was 5 billion years old? And I came from a religion that had a different age of the earth, and that's
Sure.
just crazy. But hey, let's go play
Yeah,
kickball.
I wish that we could go back in time and almost just have a video of conversations with the neighborhood boys.
Right.
I could see that being so awesome and really a great reference of kind of some of the issues we have today with just the insular nature of every sort of different group sometimes and a lack of empathy and a lack of willingness to kind of see where other people are coming from. We could just be more like children.
And it's sort of a golden age for me. I loved growing up there. I think you sort of elevate the things you remember very
Oh, sure.
positively, probably more than it was. But, we would come home from school. We all went to different schools, different schools in the area of slightly different ages and so forth. And we just played and then went home and did the same thing the next day. And all the neighbors, we'd drive up and down our big wheels in their
Sure.
driveways, and they just kind of all wave. It's like the neighborhood boys. And
I'm sure the ice cream truck was involved.
yeah,
I'm sure
totally,
there was,
and
parties in the summer, maybe some birthday things and
pool
pinatas.
parties.
And,
Yeah,
mhm.
I mean, there was a lot of profound sort of life experiences that I think shaped me a lot as a person today.
I love that. I think kids teach us so much still, and reflecting on our sort of upbringing is so important.
Well, one of those things actually, that community, that Redlands community that I grew up in, was a very tight community. My mother, I don't want to, stray too far from your initial question, but I remember one summer morning, I was going down to play with Bernie. He lived two houses down, and I was walking down the road. It was August, and it was 8 a.m., so it was already pretty
It
warm.
was 100, yeah. Mhm.
And I hear my mother just scream
Oh,
and then jump into the pool.
yeah.
And I'm like, oh my goodness, what's going on? Did she fall in? So I come back to the house and I see my mother carrying my sister as a rag doll. She had drowned in the pool. And I mean, I remember it like it was yesterday. And it was a Monday morning at 9 a.m., 8 a.m., I think. And so there just happened to be a lot of dads still around, and none of them knew CPR except one. He was a Southwest Airlines pilot across the street, and came over and did CPR and revived my sister. And she spent a few days in the ICU, and now is a dentist and seems to be functioning mentally quite well. But after that, it brought even the community even closer together. And I remember all of the families going down to the local police station, and we all took basic CPR because every house had a pool, and we all had little kids, and it was just this community that we had there that I think is just phenomenal, and unfortunately is not always the case this day and
I just
age.
think that as a mother with young children, that is the worst nightmare. My worst nightmare.
Yeah.
Thinking about that. So I just put myself in your mother's shoes, and as a brother, it's like one more event for you where you saw how people can be brought back. I mean, I just have to think that all these things really just were etched inside of you and then really came out to this fruition of becoming an interventional cardiologist who brings people back.
Well,
that's what you saw.
Yeah, it's an experience that I'll never forget for sure.
Wow. Well, I want to switch gears a little bit to ask these two things. The first one, I'm really interested in a time where you had a patient that you left and you thought, I did it good today. Like this, I saved this person. We all have these patients in our minds, on the positive side and the negative side. So I first want to ask you about the positive one. Can you tell us a story about a de-identified patient, some experience that you had that you really left and said, I made a difference today?
Well, there are a number of patients that you feel like you've had a positive impact, at least in one part of their healthcare journey, right? One of the patients that stands out is a 72-year-old gentleman who was out jogging and was found down. And glasses were broken and came in and was in cardiac arrest and had a proximal LAD lesion that we stented. That's the easy part. That's not the hard part. The hard part was, is he going to wake up? We do cooling, so we cool the brain for brain preservation. And having conversations with the family and saying, I just don't know if your husband's going to wake up.
Who the other day was running. And you didn't think would ever have something like this happen.
Right. And to have those conversations multiple days in a row, and for me to start actually losing faith that, this patient may wake up.
And then, developing a relationship with the family, I'm sure.
Yeah. And then to see him wake up. It actually probably had more of an impact on me, or as much of an impact on me as a clinician as it did on the family. And then now to see him back in clinic each day, or excuse me, each visit, and just sit there, and I literally just sit back in the chair and go, you're a miracle. And, I had a very small role in that. I mean, the stent it wasn't even a difficult case. It was just to see that transformation of that individual from someone who I wasn't actually sure would have any sort of meaningful brain function. And then to see him now, it's just amazing.
And when you say it had an impact on you, besides it being a miracle and all those things, what feelings does that bring, the impact?
Well, if you make me talk about it too much, I'm going to choke up.
Oh, yeah.
But it shows you that the human spirit and human life is not explainable sometimes. You look at this and say, all the data suggests that this patient's not going to have a meaningful recovery.
Right.
72 hours, there's no meaningful response. We need to start having end-of-life discussions. And then, for some reason, call it what you want. Miracle, science, whatever, luck. I tend to believe miracle. This patient leaves the hospital. He walks out of the hospital. And so, it resets you. You can sometimes become a cynic in the world of healthcare, pre-authorizations and, dealing with insurances and,
all the notes and
and signing off your charts. And then you see something like this and you go, oh my goodness,
sign me up.
This is an amazing opportunity that few people have in their life to be able to do. And to see, like I said, to be part of his care was one thing. It wasn't that difficult, but to watch his journey in the hospital and to see what happens with that. I mean, when I reflect on that, I could have been an international finance guy.
I was just going to say, and to think you almost were like a tax accountant.
Or a professor of Christian ethics.
Right.
Which was totally cool.
And equally important careers, but just so different.
It's just, I feel so blessed to be able to have those those experiences in my life. It's such an awesome opportunity and responsibility.
Yeah. And I know that you notice this because we think similarly on some of the operational stuff in the hospital, but probably to walk through and see all the different teams that touch a patient like that, from the OT to the PT to the respiratory therapist to the ICU attending to the cardiologist to medicine. I mean, everything. What does that look like? Somebody coming in essentially dead.
It's just, it's something that those of us in healthcare have, that no one else has. I mean, there's no other line of work, I think, that you would see something like that.
Absolutely not. Yeah. Now, the other question I ask is, I'm notorious for making people cry, and now I feel bad, but I'm glad because it's such an important story that you just told. But when I was a resident, one of my favorite mentors told me that, Courtney, you will have your own mental graveyard. Just like you have the positive stories. And I have a few patients that I will never, ever, ever forget that I lost as an OBGYN. So I could only imagine what that's like as a cardiologist. Can you share one of those with us about like what that impact? I mean, how do you keep your own mental sanity? I mean, going into a career and in a field where you're going to have some mortality.
Yeah. I don't think it's easy. I think if it was easy, I should quit.
Sure.
You sort of got to get back on the horse. One of my mentors said, Anthony, at the end of the day, when you're doing an intervention, a stent case, it's ultimately between the balloon and God. You can do everything perfectly and still have a dissection of an artery or a perforation. And, you take great respect for what you're doing. You're doing something to the human body that it was never designed to have done to it. And so complications do happen, and they're awful. It just, viscerally impacts you. You don't eat when you go home. You wake up, 2 or 3 times in the night, just frustrated by that. Yeah. I mean, I think, one of the cases is a gentleman that, we did exactly that. We put a stent in and everything went really well. And then his blood pressure fell and we couldn't bring him back. And we still don't really know why it happened. And, it's so maddening and frustrating because you did everything perfectly.
Well, and your personality is, I'm going to do it better every time. I'm going to improve.
And, I think it just gives you profound respect for the human body. It also gives you profound respect to the idea that there's a lot we don't know. So it really keeps you humble. I think you can get to patting yourself on the back too much. And I think, we need to, recognize that what we're doing is very scary, very real. And that while things thankfully go well most of the time, there are times when they do not, and it's terrible. And those cases stick with you forever.
And then what keeps you coming back the next day? Because I always say you got to get back. We have to come back, and you have to come back to work.
Well,
and get back on the horse.
Yeah, there are other people who need you. I think it's nothing like playing baseball, but if you strike out, your last at bat, you got to get back on. You got to get back up and take a swing. If you're a cornerback in football and you get beat on a long bomb, you can't remember that one. You got to focus on the next play. It's really that way. You want those life experiences to shape you, to make you a better physician, to have those experiences sort of mold your approach to a case or something like that. But it's the fact that other people need you. They're counting on you to deliver the care that you've told them you're going to deliver, right? I tell every patient that I treat you as my mother or my father, and I say that because I love both of my parents dearly. And, it's true. And so, yeah, there are things that don't go well, and it breaks you up, but you gotta refocus and tackle the next case because that patient is counting on you.
Yeah, and they're just as valuable and just as important to their own family. So what's the Dr. Hilliard legacy? Like what do you hope that, let's say someday you retire, and what do you hope that your patients and the residents you trained and the faculty and staff here say, like, Dr. Hilliard was this?
Wow. I don't really know. I think for me, being real is important. And I want people to know that I treated everyone with respect, that I valued each and every individual who stepped foot on this campus, whether it be a patient, a colleague, a family member, any other part of our healthcare team, that they were all seen as a valuable team member.
Mm-hmm. Yeah. Well, I think people will probably say that and more. And we'll hopefully leave out the part about liking the Raiders. We can probably.
Yeah. Just if you come to my house, it's very clear that I'm a Raider through and through.
I know. You do represent that team very well. And I know I remember one time you saying that it doesn't matter where they are, I will be a fan. And I feel like you're kind of that way about Loma Linda, and you're kind of that way about the mission here, that no matter where you are and what you're in, operations, or you're in the interventional cardiology suite, or you're in the clinic, that you are a fan and you will kind of take that everywhere.
I am Loma Linda's greatest fan. I'm sometimes its harshest critic, which is what a fan is, right?
Isn't that the truth?
You like
that well as a Raider fan.
You like to Monday morning quarterback sometimes, and the like. But at the end of the day, I love this place. I couldn't be happier to be here. I have no desire ever to go anywhere else. They're going to have to drag me out of this. I don't anticipate retiring. I love my job. My financial planner says I need to work till I'm 84 anyway. So
oh, gosh.
I think I'm here for the long haul. But no, in all seriousness, the mission of this place resonates very much with who I am. It's why I pursued initial career thoughts of religious studies and
Sure.
Christian ethics. The ability to help those in need, and have that be sort of an emphasis on this campus, not just part of the job, but to say this is actually part of our DNA, is what resonates with me through and through.
Wow, that's such a great answer and kind of culmination of everything we talked about today on this great discussion. And I am so intently grateful for the fact that we laughed, we had some moving moments, and that you really shared your heart for why you show up every day still. And we're, I think, honored to have you continue to lead us and to answer our phone calls when we need you as a cardiologist. And I'm so grateful for the opportunity to get to know you better, and really, really, really inspiring.
Well, I appreciate being in this chair on this side of the interview. It's certainly a different experience for sure, but I'm happy to share my story.
Thank you so much, Dr. Hilliard, for your time tonight. And thanks to all of you who tuned into this episode of Evening Rounds. Have a wonderful evening.